Sometimes patients show up and then they tell me, I just don't like my smile anymore. I don't show a lot of my teeth. I used to have this big, beautiful smile and now it's just gone. So let's talk about the face for a second. Teeth are the foundation for the lower half of the face. And over time, as you age, they're getting beat up and worn down, and the lower third of your face basically collapses. And for those of you that grind, your teeth are not only getting worn down, but they're also intruding, like going back down into your jaw. At the same time, your teeth shift in. So on top of all that, you're also aging and you're going through this aging process. So you're losing cheek fat, elastin, collagen. So your skin is starting to not be as tight. Your nose is getting longer. The distance between your nose and your lip are getting longer, and your lips are also getting thinner. So as we age, unfortunately, our face is kind of just falling and it tends to look more hollow. And so what people are doing to slow down this aging appearance is they're going in and they're getting a whole bunch of filler all over their face. They're getting cheek filler, they're getting filler in their smile lines, they're getting filler in their lips, they're getting Botox in their forehead, and maybe a little bit on the crow's feet. And I think a little bit here and there is actually okay, but a lot of people, they just get used to the way they look and then they want more and more, and they're just trying to chase this aging process, and so they end up being overfilled and over Botox. And this entire time, as they're adding filler incrementally a few times a year, they aren't thinking about their teeth at all. So what's happening is you're adding weight to the upper portion of the face. And when you smile, your face wants to go up. But when you've added all this filler and Botox and you have all this heaviness on the upper portion of your face, when you smile, your face doesn't really go up anymore. So you lose your smile. But you have to remember that teeth control the lower third of the face. So you can use teeth to balance facial features before there's a ton of work done to the face. You can add volume to the lip, you can add volume to the lower face. In fact, if you focus on the teeth first, then you actually can do less work to the rest of the face. You can actually use the teeth to make you look younger, and the treatment you need is going to be different depending on where you're at. Sometimes we need to increase the height of all the teeth. It's called increasing the vertical dimension of occlusion, or VDO, to put the jaw in the position it once was. And remember, all that wear and grinding and clenching over the years has caused the teeth to intrude, and also you've lost tooth structure. So you need to build that back up, and sometimes you can get away with doing much less. But it's important to look at your teeth first, because it's more difficult to go in after the aging process has taken over and after you've had a bunch of filler and Botox put into your face, and now you're trying to play catch up with the teeth to match where the face is at. So usually in these cases, the treatments that we have to do are far more aggressive, whereas if you thought about the teeth first, then you can usually go a more conservative route.